So I work predominantly with pharmacy students, and they really need to know about the patient side of medicine. And a lot of what we teach them is about patient assessment and how to interact with patients. So I have to figure out a way to bring patients into the classroom without really bringing patients into the classroom every day. So what I do is some activities that kind of simulate what it's like to be a patient so they can see the other side of it. So an example that we do in the classroom is that I assign a health behavior activity where they have to go home and they have to change a behavior in a healthy direction for 5 weeks so they can experience what it's like when we tell a patient, well, you need to take your medication 3 times a day forever, or you need to start a diet, or you need to start an exercise program. So the students self-select a behavior change they want to do, and they try to practice that for 5 weeks, and then we come back into the classroom and we talk about the theories that would explain why they were either successful at their behavior change or not so successful at their behavior change. And then we use their experience to talk about patient care and why patients may have difficulty in changing their behaviors as well. So it helps them understand that it's not as easy as we might think. Another example would be the geriatric medication game I do that I've adopted, that was created at St. Louis College of Pharmacy, and I've kind of tweaked and brought it here, where they actually become older patients. So they acquire disabilities such as vision disability, and in that case they would wear lab goggles and with petroleum jelly smeared over the lenses. They might have a fine motor disability where they wear work gloves, so it makes it difficult to use them fingers, or more of a general disability like wearing a sling on their dominant arm. And that simulates somebody who might have a stroke and can't use one side of their body. So then they have to navigate a healthcare system and experience what that's like on the patient side too. So they have to go to the physician's office or home, and I have facilitators at each of these stations that mimic what it might be like in the real world setting. And then they also have a station called the activity station where they have to pop open a bottle, or they have to read a bottle, they have to unbutton or button a shirt, they have to shuffle cards, activities that our older people would do on a regular basis that they might find difficulty doing when they have some of these disabilities. So really the key is to try to see the other side, see the patient side, so they can better interact with those patients and figure out and problem solve what's going to work with specific patients. Well, the health behavior change, primarily it has to do with they didn't realize it would be that difficult. And generally speaking, I have a third of students who are pretty successful at the behavior change, a third of students who are somewhat successful, they keep trying, they're not perfect, and then I have a third of the students that fail miserably, which I actually want some of my students to fail miserably so they get the real feel of what it's like. And so a lot of the feedback is, it was a lot harder than I thought. I really understand what the patients are experiencing. I'm really going to think about how hard it is when I start talking to patients about some of the changes that they make. So that's for the health behavior activity. For the geriatric medication game, I think it's one of the most memorable labs because they actually have to kind of dress up and act a part, and it's interprofessional in nature. We include nursing students and dietetic students and medical students, and we pair them into spousal or sibling pairs so they have a relationship that they're forming with a different discipline, a student from a different discipline, and then they have to dress up and act a part as an older patient. And I tell them that the more they get into it, the more they're going to get out of it. And I will say that I have students years later that will come back and talk to me about the geriatric medication game and how much they remember that and how much they enjoyed that experience. They actually want to volunteer to be facilitators in forthcoming years. So they really enjoy that particular activity. I've actually published, especially on the geriatric medication game, and looking at old perceptions of older adults as well as the development of empathy, and it does support that. And one of the key things is to kind of keep the development of empathy continue to go throughout the curriculum, because when we start throwing some of the harder subjects and all the content, sometimes the patient gets lost because they're thinking about all the different medications except how that medication works in the body. And so kind of keeping the idea of how can we continue to develop empathy and so the patient doesn't get lost in the picture. And so those activities support that. And my faculty and myself, we continue to try to develop activities that make sure that the patient is front and center and that the student doesn't forget that's who the important person is. That's why we're doing all of this.